Hi guys, and welcome back to the channel. For those who are new, my name is Fazan. I am a second year medical student studying at Anglia Ruskin University. And in today's video I'm going to go over a medical ethics interview question and just walk you guys through it for anybody that needs a bit of help. So I plan to do this and make this into a series. So please obviously subscribe if you are new, drop a like and comment with any questions that you have below, and I'll be replying to all of them. Right, so let's get into it. So the question is, a 14-year-old girl comes and asks for you to terminate a pregnancy. What are the issues? Okay, or what are the issues for the doctor? Okay, so for this question, before I walk through it, I want you to pause the video. I want you to actually answer this question that's on your screen at the moment before I actually talk you through it. So I'll pause the video now. I'm going to give you a few seconds and then we'll talk through the answer that I've made for this question. Okay, so there are 4 points that I have for this answer. One thing that I would say though is that I'm gonna start when I start my question, the answer to my question. I'm gonna make sure I talk about the most important answer at the beginning, or the most important point at the beginning, and work my way down to the least important point. I'm gonna make sure obviously that I'm not speaking too quick or too slow, and hopefully after I've finished my response, the interviewer will ask me another follow-up question, or they'll ask me a different ethics question, and that's usually what tends to be the case. So don't worry about timing or running out of time or speaking too quick. Just make sure you answer the question to the best of your ability. That being said, the first point I have, and the first issue for the doctor, is to see if the girl can actually have an abortion. So under the current UK law, you can't have an abortion if you are over 24 weeks pregnant, and so obviously that's one of the first pieces of information that the doctor needs to find out, because once he's found that out, if she is over 24 weeks pregnant, then he has to inform her that she can't get an abortion anyway, and he'll have to break that bad news to the patient, and that's going to be a difficult enough situation for the doctor itself. So that's one of the most important things that the doctor needs to find out before proceeding, because there's no point doing a whole consultation if he then finds out at the end, or the doctor finds out at the end, that she's over 24 weeks pregnant. So that's probably the most important point that he has to work out and find out. The second thing is to check the competency. Now, for those who are not aware of the Fraser Guidelines, I will be going through those in a second, or at the end of after I finish going through the points. Okay, but you need to check to see if the girl is competent. If she is, then she's under 24 weeks pregnant, then she can have the abortion and everything is fine. The third point to raise is that if the girl isn't competent, then the parents have to be involved. And if the doctor feels that the girl is at risk, for example, the doctor feels that the patient is being sexually abused, then the parents must also be informed. Because you have to remember that this girl is only 14 years of age, and that plays a massive factor. And you can link into this point that one of the medical ethical pillars, which is beneficence, is in a doctor's beneficence to breach confidentiality at this stage, and tell and inform the parents and social services of this issue. The final point, and the least important point I say least important out of all of these points are important, but the least important out of the 4 points is to take a holistic approach to make sure that the psychological impact this pregnancy is having on this patient is not too much or too hard, and just to make sure that the girl is right. I mean, she's very young at 14, so you just have to make sure that she's okay, and to basically offer any counselling or anything like that if needed. Those are the points that I have for this question. Now I'm going to go a little bit more into about what the Fraser Guidelines are, and then we'll wrap up this video. Okay, so the Fraser Guidelines are specific guidelines that are related to patients who are essentially under 16 or under 18, and is to check to see if they are competent, and it's related to specifically like contraceptive issues, sexual health issues, or sexually transmitted infections and termination of pregnancy. So usually you check to see if a patient is GILIC competent. The Fraser Guidelines is essentially something that's a little bit more specific for these type of issues. So these 4 issues on the screen. Okay, that is written there. So contraception, sexual health, sexually transmitted infection, and termination of pregnancy. So there are actually 5 guidelines that have to be met, and if these 5 guidelines are met, then the doctor can essentially give the advice that's required and that's needed without having to inform the parents or anything like that. However, it is of course encouraged that the patient tells the parent, and as it says there on the screen, if the conditions are not met, or the doctor feels that the child is being under pressure or exploited, then confidentiality is broken, because it's in a doctor's beneficence to inform the parents. Okay, so that is how I would approach this question. Like I said, I do plan to do this for more than one question, for multiple different interview questions. So make sure that you subscribe for that. And any questions, comment them down below. And thank you for listening. Thank you for watching. And I'll see you in the next one.